Hi, I'm Dr. Dimitrios Kostopoulos and I'm the co-founder of Hands-On Seminars, and today I would like to address the issue, myofascial trigger points, is there a missing link? And this is a very important topic to address because many times you go to a course, you learn how to treat a myofascial trigger point, and when you go back to your clinic, you apply what you learn and you are not effective. Or at least you are not as effective as you were promised that you will be by applying these techniques. Of course, a myofascial trigger point can be found within the belly of a muscle. We can have a key trigger point, we can have satellite trigger points around the key trigger point or in functionally related muscles to the original muscle. And of course, we may also have musculotendinous or attachment trigger points. So trigger points will refer pain to various parts of the body. Those parts of the body can be distant to the specific muscle that is affected. So it is very important indeed to know how to do the technique, how to select a specific technique and how to apply it. But knowing how to change a tire, it does not necessarily mean that it's going to solve your problem of a flat tire unless you change the correct tire. If you change the wrong tire, you still have a flat tire in the car. And this is the problem with most of the continuing education courses in the area of myofascial trigger point therapy, where you learn how to apply the technique, how to select a specific technique. But the missing link is where to apply the technique. What is the right muscle to work on? Where to do it? How to choose what muscles to treat. You see, let's take, for example, a patient who comes in to see you with low back pain. A patient with back pain, if you look at the referred pain patterns of a variety of muscles that affect the lumbar spine, you may have the paraspinal muscles involved referring back pain. You might have the quadratus lumborum muscle involved that will refer pain to the lumbar spine. You might have the gluteal musculature involved that may refer pain to the lumbar spine. You might have the iliopsoas muscle involved, or even part of the abdominal muscles involved that can refer pain to the lumbar spine. So how are you going to choose what is the specific muscle to treat? Because if you start treating randomly, every single muscle that refers pain to a specific part of the body, you're not getting anywhere. You are not specific enough. So you have to apply specific methodologies of differential diagnosis that will provide you with a key answer. So differential diagnosis as part of your evaluative criteria during the treatment of myofascial trigger point therapy is the answer. This is the missing link. The myofascial trigger point and myofascial release therapies course of Hands-On Seminars, our PT1 course, is a course that addresses, amongst other issues, that very issue, the proper differential diagnosis for your patients. If you need more information about that, check it out at www.handsonseminars.com. See you one of our courses.